थोड़ा सा एडजस्ट कर लेने दो प्लेसिंग.
Very good afternoon and welcome to the session on the topic Anemia in Women. We have Dr. Anshu Rana with us today from Apollo Cradle and Children's Hospital, Greater Noida. We welcome you, ma'am. Today's topic is important for all the women as it's one of the most crucial and delicate topic women deal with. I welcome you all to this session and I request if you have any doubts, any queries, post that on the comment chat box so that we can take your questions and doctor can answer them. So stay tuned till the last as the doctor will be taking all the questions by the last of the session. You have the stage, doctor.
Good afternoon, everyone. Myself, Dr. Anshu Rana, heading a department of Apollo Cradle Hospital, Greater Noida. And today I'm going to talk on a very, very important topic, especially for Indian women, where which this is very, very prevalent, and that is anemia. So, as a gynecologist, I believe it is a crucial to address a prevalent health concern that affects many women, and the anemia is the one of the condition where the body really needs to talk and needs the information all over, and that is to be needed for each and everyone. Then only they can be diagnosed early, and we can treat the disease. So, what is anemia? So, anemia is a condition where the body lacks enough healthy red blood cells or hemoglobin to carry a sufficient oxygen to the tissues, which is very, very important because once the oxygen will reach to the all organ, then only the organ will function properly and the body will function properly. So that it's very, very important. If we will know about the woman, in women, anemia can be particularly concerning due to the factors like the menstruation, pregnancy, dietary habits, and the iron deficiency anemia is the most common type in a woman, which we are facing in day-to-day practice, and which is used to be not only in the lower socioeconomic group, even in the higher socioeconomic group, it's very, very common. So that's why today I chose a topic: what are the factors which really causing this anemia, and where you can approach your doctor, what are the symptoms, signs, symptoms you should be aware about. You might be going through the anemia and you are not aware about this. So, in if I will talk about the anemia, the most common type, but other forms can also impact the woman's well-being. And today, I want to shed light on the importance of recognizing anemia signs first and understanding its causes. Taking proactive steps towards the prevention and manage it on an effective way. That is the only way by which we can prevent the anemia. So, one of the primary cause of anemia in women is iron deficiency, which often results from blood loss during menstruation, as I said. And women with a heavy or prolonged periods are at a higher risk of developing iron deficiency anemia. So, if somebody is going through a heavy menstruation or prolonged periods, they are the one who can be a patient of iron deficiency anemia. They should approach their doctor and they should get themselves tested as early as possible so they can be detected if she is going through the deficiency anemia. Additionally, if I say the pregnant woman required an increased iron intake, as we all know, because of the pregnancy, baby also need a nutrition for during that time. The intake should be increased, and if the iron intake is not enough, there is a chances that lady can go into the anemia. So making them more that pregnancy making them more susceptible to anemia if their diet is lack of essential nutrients, poor dietary choices such as insufficient intake of iron rich food, or can exaggerate in the risk of anemia. Sometimes even the patient is taking their supplements properly but still they are not able to maintain their hemoglobin level. That can also happen, and it's because of the malabsorption. So there is other things which is responsible for the malabsorption, where your the intake of iron is not on a proper way or proper time, or if you are taking some medicine which is interacting with iron, then also the absorption will be not okay. So for that you have to visit your doctor and know okay, what is the proper way of taking iron and how you can prevent this all these things. So if we will go in the details in the iron deficiency anemia with the name itself is saying that it happens because of the iron lack of iron in your blood hemoglobin used to get drop. So by which this is, it can be simply be taken care by the dietary intake. And if it's your anemia, again depends upon how severe it is. If it comes in a mild, there is a three forms. We are categorizing anemia in a three: mild, moderate, and severe. If the mild anemia is going on, that means your hemoglobin is 10 or more than 10, between 10 to 12, that means you are going through a mild anemia. In that situation, that the patient can be taken care by just giving the supplements and by the dietary intake. But if your anemia is coming falling in group of moderate group, that is 7 to 9 or 7 to 10, that means you need a special care. Might be the supplement is needed, and along with the supplement, sometimes the few patient are on a towards the borderline, they need the injectable form also. And we, along with the iron supplements, we ask a patient to take a good iron rich diet. So, if you will go for the further understanding the root cause of anemia, empower the woman to make informed decision about their health and take appropriate measures to prevent this condition from very affecting their daily lives, which is affecting their daily lives. So what are the other things which we have to take care? That is a prevention or the early detection play a vital role in combating anemia. That is the balanced diet, rich iron diet, essential vitamins is a crucial for maintaining a healthy hemoglobin level. Incorporating food like a leafy green vegetables and all, we all know the fortified foods are available in a market. These are the way by which you can increase your iron intake. And the pregnant women especially, they need a special attention, and they should take their supplement throughout journey. Sometimes the lady comes in OPD with a hemoglobin of 12, and they think for them the extra supplement is not needed in the further period of pregnancy. But it's not like that, because as your pregnancy will advance, the need of baby will be more, and you will need your iron for your baby as well. So your, if you, even if your deposits are good, then also you have to enrich and fulfill the extra iron through the supplements. So all the pregnant women should take the iron supplement. That is must for each and everyone. That is to be very much clear to each and everyone, that this is what I just wanted to give you a message. Because anemia, pregnancy is a one condition where the anemia causes multiple problems starting from the first trimester. If you will see, it can lead to the abortion. The anemia can lead to the multiple problems in the later part as well, that you can go into a premature labor. You, there is a chances of the breathlessness and the mother maternal problem due because of anemia, the baby's growth retardation. So many things can be happen, and that can be easily taken care if you will take care your good diet, take care of your diet, as well as you will take a supplements while during your pregnancy as per your gynec advice. So by which way we can prevent it? This is the most important thing I just wanted to say. The regular, apart from the regular supplementation, regular health checkup and the blood test is the only key factor by which you can identify the anemia at any age, or it can be detected in an early stage, which can be easily treatable. So allowing for a timely intervention and the management because of the identification is the very key factor of treating and preventing anemia. So as a gynecologist, I encourage all women to be proactive about the health and seek a professional advice if they experience symptoms like fatigue, the easily they feel very low feeling, or like their face and skin are looking pale, or there is a shortness of breathing. Sometimes the patient are complaining even with the small walk they feel very breathless. So these are the feature alarming thing which you should think you are going through anemia. And if you will notice these things on a time and you will be get yourself checked, then chances of the routine, by routine therapy and routine treatment, the complication can be prevented and you will be easily treated. So these are the ways by which. So in conclusion, I just wanted to tell you about and anemia is a significant health concern as I said early, and affects many women, but the awareness and the action on a time can prevent this disease very well. So it can be effectively managed if it will be diagnosed early, and diagnosis only will be only possible if you will be aware about your symptoms. As I said, these are the symptoms on which you should not ignore. You have to visit a gynec or get yourself checked, and with the report you have to visit your doctor. So then only you will be diagnosed. Sometimes there is a different kind of, not only the iron deficiency anemia, few anemias, multiple kind of anemias are there, and they are the one which to be diagnosed on time, then only the treatment is possible. So you should not take anemia in a lighter way or less hemoglobin in lighter way, because in long term it causes a multiple problems. Girls are facing multiple starting from the adolescent age. And I just wanted to emphasize here, so it should not be only in the childbearing age, it should be taken care from the very early age. And especially in a girl child in adolescent age, she should not go through the anemia, because the moment she will start their periods, that is menarche, if she is already anemic, so there is a chances she will land up with the severe anemia, and her growth of all the things, growth factor, all the other factors will be affected because of the anemia. So very starting from a childhood, the child should be taken care, she should not go through the anemia, and every age group the woman should be taken care. So it's not a disease of one age group, it's a disease of all women, starting from the very 5 years age up to the 70-75 years of age. If somebody is going through anemia, or especially women going through anemia, so there will be another complication can happen, and that is, it's a slow progressive disease and it involves your all system. So it can be treated as early as possible. So my today's lecture is mainly because, in conclusion, if I wanted to say, so anemia is a significant health concern and it affects many women, but the awareness and the action is the only key thing, and it can be effectively managed as a gynecologist. My goal is to empower women with the knowledge about anemia and its causes and the preventive measures. So, by adopting healthy habits, seeking medical advice whenever it is needed, and we can promote women overall well-being and ensure a brighter and the healthier future for all. So, thank you for all your attention, and I am open to any questions or discussions here for you if you have any query regarding this topic. Thank you so much.